Hey, so tonight, what I want to talk about, a couple of things, but one of the things that is an important factor for any type of metabolic condition is not just body fat, but visceral fat. And so body fat, most people think if you've ever gone or seen and somebody hands you this big yellow lump and they say, oh, this is body fat. And you think, oh, well, it just sits there and it's not really doing anything. But the truth be told is body fat is very active and does a lot of things. So in addition to storage of calories, it's also an endocrine gland, just like your pancreas. It's making different things. And the visceral fat, the fat that gets by your organs, has some pretty profound effects on how your body works. And the reason is they think that visceral fat is really more to do with liver function than anything else. So when you start to put a lot of fat around the organs, it's a sign that the liver has some insulin resistance. So as the body is trying to store calories to the liver, there's resistance there. And as a result, there's extra stress on that system. And the body then says, well, we're walling off this. And so you get this fat accumulation. The biggest single factor, aside from alcoholism, in terms of liver stress is fructose. So if you're drinking lots of pops, juices, anything that has this high fructose corn syrup, it puts a lot of stress on your liver, just from the simple fact that metabolically fructose has to go to the liver first. It can't go to your muscles, it can't go to your brain, it can't go to any other of these places. So you have this metabolic burden, this demand being placed on the liver, and it's not in a position sometimes to handle that, especially if it's an enormous amount. Like if you drink, a liter or two of pop a day or juice a day, that's a lot of fructose for the liver to have to deal with. And so the liver gets under stress, and then you see what's called non-alcoholic fatty liver disease, NAFLD. So we'll see that in the research that it says non-alcoholic fatty liver. And high fructose corn syrup would be, in my estimation, one of the single biggest factors. And the reason that that's a factor now is because it's in everything. It's cheap and it's abundant. So it's in all your sweetened things, but it's in any processed food. There's a lot of that. So I thought it would be interesting to just talk about fat a little bit more. So fat, I'm going to read off some of the lists, and I'll actually post this in the group but fat makes leptin. Leptin signals the brain about how much body fat it has. So it's a communication system between the body fat that you have and your brain. Adiponectin, I don't know why I can't say this one, plays a protective role in the pathogenesis of type 2 diabetes and cardiovascular disease, also made in the body fat. So one of the things that we talk about this is that you can increase this cytokine by cold exposure. So one of the little posts I did was about cold exposure, and it's adiponectin that is one of the ones that is released, and that's a body fat thing. There's also something called resistin. So resistin is one that it kind of resists insulin. It creates insulin resistance. And so when we look at fat, it's doing some stuff. And it's not just there sucking up as a repository for excess calories. It's metabolically active and it's making things. It also makes tumor necrosis factor, which is big for inflammation. So if you have a lot of inflammation, if you have a lot of joint pain, that could be in fact due to body fat creating this cytokine called TNF alpha. Interleukin 6, another one. So interleukin 6, I've run blood tests for several of these. Interleukin 6 is one that I ran on a patient of mine. He was having lots of autoimmune problems. And I ran IL-6, it was off the charts. Nobody ran it before. But it's a cytokine, and basically it's an inflammatory cytokine, and it has all this activity. Body fat also makes what's called PAI-1. It's an inhibitor of the fibrinolinic system and inhibition of activation of plasminogen. It just means that your body's clotting factors and things that affect the fluidity of blood. It also makes angiotensinogen, and that actually works for blood pressure. So body fat affects that. It makes free fatty acids, so when your body wants to use fat as energy, it goes free, it liberates what's called free fatty acids, and your heart burns free fatty acids, and then your muscles and everything else can burn free fatty acid. And then the byproduct of free fatty acid metabolism is actually ketones. So that's when we get into ketones and ketosis. VEGF, stimulation of angiogenesis. So when you're storing body fat, you also need blood supply to that body fat. So VEGF, it's vestigial epithelial growth factor. What it does is it's making new vessels for blood. So that's one of the things it does. There are two more. There's IGF-1, but there's also something else. And I don't think I'll post this here, but body fat is a peripheral site for testosterone to turn into estrogen. And then estrogen is going to be more pushing towards accumulation of body fat. So it's a vicious cycle. So the more body fat that you have, the more body fat you will continue to have. So this is why some of the things that we advocate, the intermittent fasting, the fasting, certain nutrients that we recommend, this is why we recommend them, because we're trying to break this cycle and begin to metabolize fat as energy and change the hormonal dynamic of what's going on. Because as you accumulate body fat, especially if you accumulate it for men around the waist and for women on the hips and buttocks, that creates a certain level, a certain wall of insulin resistance. So we want to try to metabolize some of that fat as fuel. A pound of fat has 3,500 calories. So if you're carrying 20 extra pounds, which probably most of us are, but if you're carrying 20 extra pounds, that's 70,000 calories that could run your body. So if you have 2,000 calorie a day metabolism, that'll run your body for 35 days. So that's enough fuel to keep everything running for 35 days, which is pretty amazing. It's a pretty effective system in terms of increasing our ability to survive famine. It's definitely a modification that the body has come up with over time. But that's what I wanted to talk about. I think the emerging understanding of what is happening in metabolism is taking these things in effect. I look at like different pieces of research, and I see that there's starting to be some focus on visceral fat especially. And incidentally, I kind of came across this because I was looking at some stuff that was being done with patients who had AIDS, and they developed a medication to eliminate the visceral fat, because one of the other medications caused a very rapid accumulation of visceral fat. And then what would happen was, these patients, in addition to having HIV and AIDS, they developed diabetes. And so they were like, whoa, what's going on here? So it's interesting how things happen, but the hormonal systems are very correlated with each other. And you can see that body fat is doing a lot of things, and has a pretty strong effect on your physiology. So it's not just some inert, dead stuff that, you know, that someone slaps on the table and goes, oh, there's 5 pounds of body fat. That has an effect. So as you start to lose body fat, you'll notice that you're going to lose more body fat. And as you accumulate body fat, you're going to want to accumulate more body fat, because this is the accumulation part is the broken metabolism. And you know, broken metabolism in my mind is several things. It's not just insulin resistance, it's leptin resistance. It's high inflammation, high blood pressure, high all of these different factors. And they can actually be handled metabolically without medication if you know what you're doing, and if you know what tests to run, and then if you know what dietary indications to make and what lifestyle modifications to make. There's a video I talk about sleep. Sleep is enormous. It has an enormous impact on this. So it's a complicated situation. I will probably revisit this topic in more detail. Maybe I'll do a whiteboard on it. But I just find it to be fascinating, and that all of these different things are going on that most people just have no idea that this is going on. They know something's not right, and their innate intelligence, the body, is saying, hey, something's not right, but we can't put our finger on it. So this is one of the more interesting things. The next thing that I probably will do in a video is also, I'm going to talk about circadian rhythm. And circadian rhythm is a very fascinating system that the body brain has to orientate you to day and night. And in our modern world, we're having problems that are basically circadian mismatches. And it also moves us towards metabolic disease. So we know certain foods are triggers, we know certain behaviors are triggers, we know certain day and night light cycles can be triggers. And to just say, I'm gonna fix this with diet is difficult, because there's oftentimes several other factors that are in place. So this is something that we'll brush up on again too, which is circadian rhythm, and we'll come back and probably do some more talk about visceral fat. But that's it for tonight. Enjoy your weekend, and I'll see you on this sometime soon. If you have any questions, leave them in here. Again, like and share if there's anything that I could do, or somebody should be listening to this. And then we'll be back here, and we'll hopefully have some more people commenting about the things that they're doing, the dietary and lifestyle changes that they're making. All right, that's it. Have a good night.